So hello and welcome everyone to the 2021 Quality Improvement Projects group discussions. Before we get started, I'll just go over a few housekeeping details. So this session will be recorded until later on when we move into breakout rooms, but just know that. If you're having technical difficulties, just utilize the chat feature and I can help assist you. And then we encourage questions and interactions with this discussion. So feel free to have your camera on or use the chat box, or when the time comes to verbally unmute, we highly encourage that. Also, feel free to go to the participants box and then use the raise your hand feature. That's another great way that we can help call on you if you have questions. And when you're finished speaking, just please remember to mute your audio just to avoid background noise. So I'll get us started and just kind of reset why we're here. So learning objectives for this session. At the conclusion of the session, participants will be able to describe the model for improvement framework and its application to Flex QI projects, use the Plan, Do, Study, Act tool to recreate a plan for their state's quality improvement project, and articulate next steps related to quality improvement project, including deliverables and support resources. So thank you for pulling up the slides, Sarah. And at this point, I will hand it over to Natalia to go over or welcome.
Hi, everyone. We're so excited that you're joining us for this session. This is a really important session, and we hope that after today, you will leave with some clarification about what is coming for year 3 in terms of what we're hoping to accomplish as a group, collectively and individually, for the quality innovation labs, but also the Flex project as a whole. And in today's session, we really will be rolling up our sleeves and really thinking deeply about each of the components that will be needed for us to execute those projects. So first, I will just like to provide you an overview of the objectives from the federal perspective of what we're hoping to do with the quality improvement projects this year. And so specifically, I want to address the objectives of the innovation labs, as that is sort of the direction that we're heading into in the fall by launching the quality innovation labs after you all received approvals for your projects. And so this quality innovation lab idea is really cemented on almost like a learning collaborative approach of really facilitating peer-to-peer learning, collaboration. And that way we're hoping that you can really bring your ideas to the table and really support innovation around QI. We're also hoping to support the state Flex programs in increasing capacity for using quality measures to drive improvement and to understand what are the gaps in that area, and how can we best support you at the federal office to meet your individual project goals, but also the overall goals of improving quality of care at critical access hospitals. And then we will be really addressing this concept of building evidence in rural quality measurement and quality improvement by working in partnership with each of the states, to meet our aims at the national, at the program level, at the state level, and at the hospital level. So here lies the complexity of this overall endeavor. Is really a multi-level project. And without going further into that detail, I want to share with you more specifically about what our aims are at those levels on the next slide. So I think it's important for you all to understand how we're seeing the world at the federal level. And sometimes that can be a little bit of a holy grail, but I want to be really transparent and sharing those aims with you today, because understanding why we're doing things, I think, really helps to drive the work and really can help you, bring more practical ideas to the table to help us partner in meeting these aims. So the first one is a national level aim, and that is, we're hoping that these projects will really be informing our strategy for rural quality measurement and quality improvement based on how we are able to implement the state projects and disseminate lessons learned. I think there will be a lot of interest in our federal partners to understand, what are the unique needs that are being addressed at the rural hospital setting. And I know that will raise the visibility of rural healthcare and the needs that we specifically have in terms of quality measurement and improvement that have been so difficult to address up to this point. We have a dearth of measures that are rural relevant, and this is definitely our way to raise visibility of those issues and push for some feasible solutions. Secondly, we have a HRSA, or the programmatic level. So that is implementing this collaborative approach to integrate program efforts that we fund and resources that you all may need in order to enhance support for you to be able to really sustain the efforts that you're doing in quality measurement and improvement in your own specific states. So we really need your help there to work in collaboration with our TA partners to help us understand a little bit better what is the most tailored kind of approach that we can implement in order to meet those needs. And then at the state level, we want to identify what are the gaps that exist at the national level in terms of program QI, program capacity in QI. And that can be, in terms of knowledge, services that are provided at the state level, or resource needs in order for you all to meaningfully engage with critical access hospitals in quality measurement and improvement activities that currently are part of your work plan in the grant. And then we need to assess how quality measurement and quality improvement innovations at the state level can actually influence the hospital level improvements in care. So we are going to be looking at it from the perspective of the work that we're doing through this program at the state level and how that drives actual improvements in care at the hospital level. So it's a different way of implementing that quality measurement, the quality concept really, which is both at the state level and at the hospital level. And then finally, at the hospital level, we want to identify what are some feasible and relevant approaches for assessing the quality of care that patients receive at critical access hospitals, and the innovations in quality improvement that can help you mitigate data reporting challenges and reduce reporting burden for critical access hospitals. This will also help inform a strategic plan specifically for MBQIP. So we want to, again, be able to feed that back into our program. It's an information feedback loop that we're hoping will be very practical in the sense that it will be in partnership with you, really from the ground up. So on the next slide, I will just go over what to expect from the innovation labs. So we're asking all of you to collaborate with critical access hospitals to assess the needs and really get buy-in for this QI project. So I know that you all received some pre-work questions, and this session is really meant to get us started thinking about how to put that into practice, how to begin really dissecting that collaboration piece with your critical access hospitals and get you thinking about, in a practical sense, how are you going to, through one specific topic area that you have selected, engage with those critical access hospitals to execute your project. And so all of the steps that we have built into that template that was provided to you and that we'll be discussing later, are really meant to help you incrementally get to the steps that are needed to really execute your project well. So we're also asking you to collaborate with other states on your individual projects. And we really think that that's where this project is so unique and different that can bring a lot of value, whether you are a state that is really advanced in your quality improvement experience, or perhaps you want to grow that expertise, because you will have the opportunity to either learn by mentoring your peers or really helping others understand something that has worked well in your state, but also from that interaction, be able to apply it back and bring that knowledge back to your own state. So we're looking to have a team-based approach for innovation and quality improvement. And the state teams will be receiving that additional support from a group of experts in quality improvement that can really help you start thinking. I know that some folks don't have expertise in quality improvement, and that's okay. I think the idea is really to help you manage the work that you do in quality improvement in a better way. And that again goes back to that aim that I explained earlier about building capacity at the state level to do those activities. And then finally, you will receive assistance to package these QI ideas for implementing your changes and showing how that change leads to improvement. And that's where my colleagues will go into explaining how to use the tool that we shared by email that will build on the activities that you do as a group, as a team, and how you are expected to work together throughout the year with your assigned experts or facilitators and QI coaches to receive that support in order to complete that at the end of the year. And then what will be so nice to see is that by your participation in those innovation labs and your input into that tracker that we shared, you will have a final poster that will be completed and sort of turned back into us. And at the end of the year, you will not have to do much in terms of a report. It will be sort of captured incrementally throughout your participation in the innovation labs. But that's a very high level overview, and I'd like to turn it over to our partners at Arkita to go over what this particular session objectives are, which is built in sort of a workshop style, but they will explain each of the steps that will need to be executed in order for us to successfully launch the innovation labs in the fall. So thank you, and I'll pass it on to Stratus Health.
Thanks, Natalia. So Andy read the objectives for us again, just to reorient what we're planning to address today. By the end of this session, you will be able to articulate the next steps related to the QI project, including deliverables and support resources. You'll be able to describe the model for improvement framework and its application to your Flex QI project, and use the Plan, Do, Study, Act tool to create a plan for your state's QI project using the template that was provided to you yesterday, and is also available for download in the session area of the participant portal. So we're going to start with the end in mind. So rather than going through the template first and an example, we're actually going to tell you what's going to come next so that you have the ability to kind of frame up what's going to happen over the next couple of months. So we have a high level timeline here. We're going to talk through each of the points on this timeline, but you can see at the front end, we have the reverse site visit session today. And at the back end, we have the MBQuip Quality Innovation Lab kickoff on September 16th. So we have a slide for each of these points along the way so that you're familiar with what's coming next. After today's session, we want you to be aware that representatives from the federal office, from TASC, FMT, and Arkita are going to be available to provide technical assistance during 2 office hours sessions via Zoom next week. And these will be on Tuesday, July 27th and Thursday, July 29th. So information about these particular office hour sessions were sent in an email from Tori earlier this month. I just want to point out that the email that Tori sent included join links for the Zoom meeting. So if you click those right now, it's going to tell you the meeting isn't happening yet. The links on these slides are actually registration links. So if you want to click on these links, you can go ahead and register and get holds on your calendar for one or both of the days if you're interested just in holding the time. So really what these are an opportunity for you to receive TA related to your QI project plan deliverable, which Natalia is going to speak to next. We'll be spending the most of today's session discussing that QI project plan deliverable. So we're hoping that you'll leave with a lot of the tools and the information that you need to populate it. But as you go forward, if you have questions, please know that these 2 office hours sessions are available to you. We don't have any content planned for these sessions. We'll be waiting for folks to join and to ask us questions. So you may want to hop on to see what other people have to ask, but you also will want to come with your questions in mind. Natalia?
Thank you, Sarah. So we are asking each of the states to really focus on the plan portion of the QI project template. So we know that it can seem overwhelming to have that many pages, but as I said earlier, this is a buildable tool that you will be using throughout the entire project. And we understand that you may have components of your plan that may need to be fleshed out as part of your conversations with hospitals and your own teams. But based on the concepts that were submitted to our office and were approved, I think it is very feasible for all of the states to have your high level plans outlined. And this is to really help you start thinking of those pieces, what those may entail. And we're going to be providing some very specific examples that may help you more concretely derive those components. So you will need to submit to us your plans via email at task@ruralcenter.org by Friday, July 30th. So we are not expecting you to have all of the answers, but we are looking for your high level plan portion. And hopefully in today's session, you will have an opportunity to really address some of the questions that may come up in terms of what that really means. And we will go over what those expectations are more specifically next. Thank you.
So to support the state flex programs with the work that you need to do to kind of meet some of the aims that Natalia identified and described before, we've met with all of the different partners and reviewed the applications that you submitted to F4HP, and know that some of the state flex programs have already engaged or identified a subcontractor to assist with their project. And some of you are still working on that, which is completely understandable. So we have a virtual knowledge group call coming up on Tuesday, August 10th from 2 to 3 p.m. Central Time. And what we'll do during that session is share a very small presentation at the beginning, but some kind of hints and best practices for managing a contract within your program. So for some of you that might be kind of old hat, and some there might be some new things to learn, but definitely something as you move into this project with a very rapid cycle that needs to kind of hit the ground running, what it is that you could do to kind of tee yourself up for success and to gather the information that you need throughout the course of the project so that you're not at the very end kind of scrambling to find information about the project's impact. So we'll talk about that a little bit as like a mini presentation at the start of the call, and then have some state flex programs prepared to share some of their ways that they've troubleshot contract management within their different types of organizations, be it governmental and university-based, and then just have an open conversation with those state flex programs that are able to join the call that day about what you do with contract management and some of your best practices, your hints or lessons learned to share with another. So that call notice has gone out from Andy, so look for that in your email with the save the date, but we'll send more reminders to as that date continues to approach.
And another step in this timeline after that is that during August, Flex monitoring team will be holding some focus groups. So we'll be reaching out to Flex coordinators in the next couple of weeks. The focus group will take place in August, and the goal of these is really to have a discussion with Flex coordinators and to gain some additional information that we think will be really helpful as we go into some of the data collection for the labs this year about kind of data that's already being collected to try to prevent any additional burden on state Flex programs and preferences for data collection and reporting. And so this will really inform kind of the collection process during the labs, and we'll share more information about those specific discussion points as we get closer to the date. Some of that will be based on the information we collect by that July 30th deadline.
Thanks, Megan. And then another piece that will be happening for some, but probably not all of you, is that the ARKITA team will be reaching out to some states for follow-up, whether or not it means we have questions, whether or not we just want to understand better what you're doing, whether whatever it might be. Some of that will be driven by what we see on your project submissions. We may ask other partners to participate on those calls, depending on what we're trying to get at when we reach out for those. We're also available, and I want to acknowledge Misty, your comment in the chat. I'm sorry that we're on top of the Regency meetings for the open office hours, and we were trying to find times that were sort of best across multiple time zones that we could have multiple team members available. So we are not going to be able to get another scheduled, but if there's anybody in Region C who wants to talk with us, we're more than happy to do that offline, or just shoot us an email. We can definitely accommodate technical assistance. That's not your only option to ask questions or for help. We just wanted a broadly available option so that you can kind of have a forum that you know you can ask those questions in. There'll be multiple folks on. You can hear what other folks are asking about as well. So we are happy to help outside of that as well in terms of the availability. So the other thing that will be coming up then, and Sarah mentioned this already, that really the kickoff to the quality improvement labs or the quality innovation labs will be at the virtual knowledge group. This should already be on your calendar. This is the date that we've had set actually for several months now as we set those virtual knowledge group meetings at the beginning of the calendar year. So it's Thursday, September 16th from 2 to 3:30 Central is where we'll really dive in with the Quality Improvement Project kickoff and the Innovation Lab. So all of this sort of kind of pre-work lining up to the launch. We know that lots of you are already talking with your hospitals, doing a lot of the planning behind the scenes, which is fantastic. We're really excited to see, we've gotten to see sort of your one-page summaries that you've submitted with your NCCs. So now we're really excited to dig into more and better understand what's into your plan section as you're diving into this work. So you can, if you're not already registered or have that on your calendar, you can click the link there that's in the slides. Sounds like there's some links issues, but I know Andy will be on top of getting that cleaned up. I see that in the chat as well. So please plan to participate in that with us as well. Okay, so that's sort of the timeline and what's coming. Just for some level setting, you can go to the next slide, Sarah. I just am going to do a really quick overview of what the model for improvement is. So I recognize among the folks on this call that many of you teach this yourselves, so you are definitely experts in it. But for some of you, it might be kind of new and unfamiliar language. So we just wanted to take a couple of minutes to do a little bit of level setting about what we're talking about when we talk about the model for improvement. It is one of multiple different models that you can use to implement quality improvement practices. It is probably the most commonly used one in healthcare, and one of the reasons I know Stratus Healthy is always uses it a lot, and I think the Flex program and FRHP is drawn to it as well, is because it's really pretty elegant in its simplicity. It really helps you narrow in with these 3 questions. So when you're doing something, approaching a change or a test of change using the model for improvement, you start with these 3 questions. First of all, you want to be clear about what are you trying to do. So this is where we're really trying to understand what is it that you want to do with your plan or with your project. You need to know how you're going to how that change is an improvement. So that really gets into what are you actually going to measure. So making sure you know where you're aiming and then how you're going to measure whether or not you've gotten there. And then thinking about what change you can make that will result in improvement. So those are really the first 3 questions that set you up to actually do your plan, do, study, act, or your PDSA cycle. And I would envision this QI project as sort of both a giant PDSA cycle over the full course of the year that we're learning from and testing, But I also think that individually, our Arcata team, and I think your Flex teams too, will also be trying things out and doing things and trying to learn as we go in sort of smaller PDSA cycles as we go. So as you implement a learning session or a sharing session, you find something didn't work, you do something different. That's its own little sort of mini PDSA within that. So once you've identified your kind of key 3 questions, then you dive into your actually plan, do, study, act. And when I teach model for improvement, when I'm doing the full thing, I think I have about 4 or 5 slides on plan. So planning is really where a lot of the success happens. One of my favorite quality improvement mentors used to always say, plan the work, then work the plan. So the more kind of time and thought that you're able to put into some of those details and anticipation about what that's going to look like in the plan, hopefully the better that it's going to support you and train you as kind of support that work as you go along. So we're going to be diving into the plan. Most of what the rest of the day is going to be the planning piece. But then once you have your plan, you do it. You try, you see what goes, you document what worked, what didn't, how did it align with what you thought you were going to do and what direction it was going to go. And then you take a pause and you look at that information, you study. Some models say check, plan, do, check, act. Most now use study because you want to think about it a bit more. And then you act. And when you act, it's really kind of thinking about, did it work? Am I going to move forward with this? Am I going to expand it? Am I going to change it? Or am I going to just kind of ditch this idea? It didn't work. I'm going to do something else. So this model can be really used for something as big as implementing a multi-hospital QI project, or something as small as making plans around how you are going to. The example I always use is get out of work and get out of the house and on time every day, which, you know, now that we never leave our houses doesn't work very well. But there used to be, I used to talk about whether or not you would lay your clothes out ahead, or you would pack your lunch ahead, or you would set your alarm earlier. What are the different things that you could test and do to make if you were, and then monitor your time for how long it would take you to get to work. So that's really kind of the basics of the model for improvement. On this next slide, we just want to have a couple of tips that we wanted to share with you. I think the first one is super important, and we're looking forward to seeing your plan sections. I think some of you already really have this sorted, and some of you are still kind of working through it, is just be really clear about what problem you're trying to solve. I think that in that first question, in the kind of setting you up for success, is really important. Also really important to learn what has worked for others. So that's one of the reasons our team's excited about the opportunity to do the quality innovation labs. Really an opportunity for you to share. In the quality improvement world, we often say copy, 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 or steal with zeal, as long as you kind of reference back to your documentation. I am not advocating in violation of copyright, but certainly lots of folks have been working on the areas that you're going to work on what has worked, what hasn't, how do you kind of copy and adapt those solutions for your environment. Also important, even though I kind of emphasize the importance of planning, it's also important to know that you don't need a perfect solution the first time. It's better to have a plan and start working through it than it is to plan and plan and plan and plan and plan and then not get to the actually working on it. We encourage you to look for ways to limit variations in the process, which is really kind of a fancy way to think about how do you streamline and simplify things. We tend to be able to stick to things that we are simpler and streamlined, so less steps, less complication. Is there ways that you can make that as simple as possible, and then continually evaluate and seek opportunities to improve? And so a lot of what we'll be doing with the Quality Innovation Labs is those opportunities to kind of continually evaluate, share with what you're doing, learn from each other. And then the next slide, this is just a reminder that this resource is available for those of you that teach quality improvement. It might not be where you want to go, but you might want to point your hospitals here. For those of you that are still kind of getting familiar with some of these concepts, Stratus Health does have a whole curriculum or course available on our website free of charge. There's 12 different modules, there's videos, there's slides, there's transcripts, there's tools. I think the longest module is about 45 minutes, but most of them are less than 20. I think the 45-minute one kind of is the putting it all together package. You can just pull out pieces and parts of that. There's also a facilitator guide and a sample syllabus if you wanted to use that. with your hospitals. I know a couple of flex programs have done that, and several of the quality improvement grantees from the FOHP have used that resource as well. So that was your very high level overview of the model for improvement and a point to more resources. So I'm going to turn it back over to Sarah to dive into the details.
Great, thanks, Carla. So I just have to change my screen share. Patience with me for a second. Okay, can you all see a Word document on your screen now? Looking for a nod from Carla or Natalia. Okay, great. So I'm going to walk us through the template, and it was sent out via email yesterday. There was some talk and chat. It is available for download in the download area of the conference hub. For the sake of time, I'm going to ask that you hold questions until the end of the session. We're going to walk through the template. We're also going to walk through an example of what your initial deliverable will look like. But please do jot your questions down as we go, so that if we don't end up answering your particular question throughout the course of the presentation, we can make sure that we circle back and address it at the end. I want to start by saying that we initially developed this template in PowerPoint, and it felt a bit more palatable in PowerPoint, but recognizing the limitations of collaborative editing in that format, we opted to build this out in Word instead. So as a template, you'll see that the document is 10 pages in length, but please don't let that be overwhelming to you. This is intended for you to use throughout the course of the year. You are not going to be populating the full template right now. You'll be completing it as you go. And the intent is, as Natalia spoke to, and we're going to address in a moment, at the end, you'll have everything you need to really fulfill the final deliverable of kind of a project poster that serves as a report of what you did and what you learned. So you aren't scrambling at the end to kind of think about, oh, what did we do then? We're building it into the process as we go. So the first page includes a table of contents, and this is click navigable, so you can easily jump to any point of the template. And Natalia mentioned at the beginning of the session that we're going to be providing support through the Quality Innovation Labs in completing your final project poster. And all of the information that you're capturing throughout this template is going to aid you in completion of that deliverable. So before we actually walk through the template, I want to jump to the end and show you the outline for that final poster and turn it back over to Natalia to speak to that for just a moment.
Yeah, so this is where, again, we're taking that improvement science and also an implementation science approach to this project and really walk you through the process without you really feeling like, I can't do science. So this is really, you know, an easy way to capture what you're learning as you go. And we're hoping that, you know, in the background section, you tell us, you know, why did you pick this project? Why was it important to your specific state? So in the end, we want to see that across 45 states. And we'll have a beautiful map of, and be able to understand at the federal level what's important at each of the state level, at the state level program. And, you know, really what you were trying to accomplish by proposing this project. We're also looking at the project aims. So this is going to describe, you know, if your measure is going to actually lead into a change, and what are you hoping to accomplish there? And then you will go into your, you know, the how piece. How are you going to exactly get that? And what were the results? And then what did you learn? And the conclusions that you drew from the implementation of the project. So what modifications may you do? Like, would you expand this to other hospitals, or is this, you know, something that taught you, you know, it's applicable only to the few hospitals, but then, you know, what comes next? So those are all very important pieces of information that we're interested in at the federal level. And we're hoping that by having this built-in approach, that you will not have a lot of burden in terms of just turning this in the end. So really at the end of the year, you can be so proud of yourselves that, this is sort of going to capture all of that hard work that you did together and individually. And it will be a dissemination type of product. So it's really for us to explore at that point, how do we really shine a light into the work that you're doing at the state level to make this happen. So I'll turn it back over to Sarah to go over the rest of the template.
Thanks, Natalia. So what you see here are 6 major buckets that Natalia just spoke to through the background, the project name, the project design, and so on. Anything that's in blue hyperlink is linked within the template. So Alia asked in the chat, and sometimes Word is finicky. You have to hit Control and click to be able to navigate when you're in an editable format. So if it's not working, hopefully that works. What you'll see is like under background, we have these questions. What are we trying to accomplish? Why this project? If I click on that link, it takes me to the section of the template that addresses those set of questions. So that's where I would go to get the answers to the questions for each of the sections of the poster. So now we'll walk through the template. I'm going to do kind of just a high level overview. The second page is this overview of what's included here and kind of how to use it and some how-to guidance. Some key takeaways here, this is a template. And we know Flex is baked into the name, right? One size rarely fits all. So please add to this as you see fit. If something doesn't feel like it aligns with your project, it can be removed. It's why it's being provided in Word. What we're really trying to do is give you the tools to be able to provide that final report and poster in a concrete way. So if it doesn't fit, you don't need to do it. If there's something that's missing, add it in. This is now yours to run with. Throughout, there are text in italics that those always indicate kind of instructions or additional prompts to help you guide completion. Any text that's in this type of curly Q bracket is something that's to be deleted and replaced with project-specific information. So right away, for example, you'll see that at the top here, you're going to want to go into the header. You'll double click into the header and replace this state indicator with your state name, and then the project name of your project should go up there. And then that will repeat on every page because it's in the header. We also recommend that when you are getting into this, that you save your version of the template. You can remove the term template from the end because you're actually using it. So it'll be your 2021 QI project tracker, and that you add your 2-letter state indicator at the beginning. In addition to submitting this initial run at completion of the plan section of this template as your deliverable for July 30th, you'll also be sharing these trackers as part of the QIL going forward. So having a common section will just help all of us be able to understand who's we're looking at as we're going through them. A couple other things to note, this template's built with page breaks throughout. If you dislike Word, it might throw you for a little bit of a loop with page breaks. If you're not familiar, at the top, you can turn on the show hide option by clicking the paragraph symbol on the home ribbon, and that will show you where the page breaks are. So if you're like, why is this on this page and this is on this page, some page break things might be coming into play there. And we already talked about the fact that hyperlinks within the template point to places to aid in navigation. And Carla spoke to our QI Basics course that's available. If there's something in this template that's kind of throwing you and you're not familiar with it, know that we're here to provide you with support. As always, you can send your questions to task@ruralcenter.org, and the team at TASC will help route them to the appropriate partner to be able to provide direction and assistance. But that QI Basics course, if you haven't checked it out, we do have an entire section that's focused on the model for improvement in PDSA, one of the modules. And actually, this template was based off of the tool that we developed for that course. So I'm just going to slowly kind of scroll through each of the pages. This first page of content should look familiar. Tori sent an email out with the model for improvement 3 questions and asked everyone to be thinking about those as pre-work for this session. We're going to be walking through an example project shortly, and that will include how these questions were answered in relation to that example project. So hopefully this helps you get started in meeting the deliverable. You've already come with some of the next deliverable answers in mind. The next portion is plan, and this covers, in the initial template, this covers 3 pages. By the end, you might have more. You might decide to roll them into shorter pages. Do decide what makes sense to you in terms of a layout. But there are 3 essential questions that we're going to be answering in the plan phase, and we're going to walk through the examples that are provided here step by step after we've gone through the entire template. But essentially, the first question is, what will we, the Flex program, do that will result in an improvement? And that is really to keep the focus on what are you going to do at the Flex level. We know that we're looking for outcomes at the hospital level. How are you at the Flex level going to be impacting what the hospitals are doing? So we'll walk through some examples here shortly. As you go through the implementation of your plan, as Carla said, plans change. So best laid plans, it's really important to be mindful of setting your plan, but your plan may change throughout the year. And there is a section further on in the document in the do phase. And if you were to click the link here, it would take you to there to be able to capture some explanations for changes that you made so that you don't forget, oh, this is why we changed that in November because it didn't work in October. Or this is why we did that in February because people weren't available, or whatever you did, you learned from the QILs, or you found a best practice from somewhere else, or you decided to kind of shift gears. You can capture that as you go so that you remember and have that at the end when you talk about your lessons learned. So there's some examples that are provided here. You'll note that they're in italics. You can go ahead and delete those and start from scratch. If some of them resonate with you, if you have a Susie and a Bob on staff and you want to keep them, you can feel free to do that. Make sure the big thing is that we want you to be describing the activity, capturing the person responsible, a high level idea of when something's going to be done at the least, if not a specific due date. And then that's a space for your notes. And again, we'll talk through an example in a moment that gets into this in more detail. The second area of the plan that you will be expected to submit with your July 30th deliverable is what you plan to measure to evaluate your test of change, again, at the Flex level. So all of your states should be tracking on the number of hospitals that achieved a performance goal for a given activity related to an outcome measure. You're going to be moving towards getting your hospitals to achieve a certain level of performance, or you want to move them in the direction of improvement on a particular topic area. So that's going to be one of the measures that you're looking at, and Megan's going to speak to that in a minute. You'll also want to develop some process measures that align with the activities that you're implementing, and we'll talk through some examples. So again, these are some examples. They're in italics. If they resonate, keep them. If they don't, delete them. But essentially, you'll want to capture the measure that you're looking at, what your goal is. If it's applicable, you'll notice that there's an NA here. We'll talk about why that is and an example of how you might think about your process measures in a kind of nuanced way. What your denominator is, we're suggesting that that's something you would want to track on. If that does or doesn't resonate for you, you can alter that column. Your outcome and result, you won't be able to populate that right now. Your outcome and result is what you're going to populate at the end of the project. We want to capture it in this template so that it's ready for you to populate and you have everything in one place. But when you submit your deliverable by July 30th, you won't have that outcome or result column populated. And you may or may not have notes at this time. Your notes might come as you go about the process of implementing your project. The third and final section of the plan that you'll be submitting with your July deliverable is measuring, what will you measure to evaluate the test of change at the hospital level? And Megan is going to talk through an example with us shortly with regards to kind of the level of data and information that a minimum level of information, and then some other key considerations when you're thinking about what your hospitals are tracking on and the data, how you're going about gathering data from them. So we're asking you to name the measure that's being tracked, provide a measure definition, and we'll show you an example of how we defined our measure in our sample project. Measure specifications, so either describe the measure specifications or link to measure specifications that you're using for data collection. And then what's your data source? How are you going to gather the hospital level data? Are you pulling from a measure source or measure repository? Are the hospitals reporting it directly to you? How are they reporting it to you? That type of information is what we're looking for there for the data source. Then once you have your plan in place, you go about implementing. And as you implement, you'll want to kind of be tracking on this do phase. So this is capturing notes regarding your flex level interventions. What happened as the project was implemented? Were you able to implement each aspect of the project as expected? If everyone says yes to that, I'll be super surprised, because that's not how quality improvement works. We're always making changes and adjusting on the fly. And so things are going to not look exactly like your plan stated. This is your opportunity to capture any deviations from the plan and why they were made. What surprises or challenges came up along the way? How did they impact the project? What changes did you make as a result? So just kind of framing those concepts in a couple of different ways. Really, again, this is to help you be able to complete that final poster presentation at the end. What did you learn as a result of the project? So this is, if you want to think about the do is as you go, what are you learning? And then the study is at the end. So what were the results after you've collected and documented all of your final outcome information, again, in that plan section. So that's where you're going to be filling in the outcome and result column. You're analyzing the results and summarizing and reflecting on what you learned from the project, and that's what you'll put in the study area. The final section is act. So this is where you decide, are you going to adapt, adopt, or abandon? This is an opportunity for you to think about how you're going to incorporate what you learned from the study that you did into future projects. So are you going to adapt? And in this case, that might take the form of modifying the approach or approaches that you took in engaging hospitals. Maybe you want to take a more collaborative approach to future projects, or focus more on one-to-one TA, or change your data collection processes. What did you learn, and how are you going to take that going forward? Are you going to adopt? So are you going to use the same approaches from this project in future projects? Are you going to take this exact same plan and now move to 5 different hospitals than you worked with the first time? Are you just going to kind of reuse what you did here? Or abandon, which doesn't mean that you abandon the cause. It doesn't mean you stop trying to work on quality improvement, or that you even stop trying to improve swing bed measures or whatever your topic area is. It just means that the approach that you took didn't work, and you need to kind of shift gears completely. So that's what the abandon option is. And so then there's a space here for you to indicate what modifications you're going to make, or changes that you would make for your next project. And then that leads us into the final poster outline that we looked at the beginning. So that is the template. Again, we're going to be using it throughout the year. The intent is that by July 30th, you will be ready to submit the sections. You'll be able to answer your model for improvement 3 questions, fill in the plan for what you as a flex program are going to do that results in an improvement, which you're going to measure to evaluate the test of change at the flex level, and what you're going to measure for the test of change at the hospital level. So I'm going to go back out to our slides so that Carla can walk us through the first part of our example project.
Okay, so we picked a project that nobody picked because we wanted to give you an example, but not confuse anybody by saying, well, that's what we're doing, but we're doing it differently. So we decided that our example project would be that we think that it's really important for critical access hospitals to ensure safety of their staff by improving rates of COVID-19 vaccination among healthcare workers. I bet you nobody is hearing about that right now in their states right now. So this may not be your QI project, but it might be something that everybody is looking at. Why we want to accomplish that? We know that vaccination rates among rural healthcare professionals in most areas is lower than urban counterparts. A little bit of detail. It really can impact unvaccinated staff. It impacts staffing and care available. It's important to show leadership, all sorts of reasons of why it's important to focus on COVID-19 vaccination rates among healthcare workers. So really just kind of some key bullet points of what we want to do and why we want to do that. How will we know that a change is an improvement? We propose that the participating critical access hospitals will share their healthcare provider COVID-19 vaccination rate as of August 2021, and will report rates of vaccination at various points throughout and at the end of the project. We said we were going to use the HCP COVID-19 vaccination rate using the NHSN definition. So this is a measure that can be reported into CDC possibly is going to be required to be in CDC. It's not required at this point, but that's where we would pull the definition for our measure for this project. What change can we make as a flex program? If we were a flex program implementing this, we could provide tools and resources and templates to participating facilities. We would convene them monthly to share challenges and successes. We think it would be important to include sharing performance scores across participants. I know some of you do that now with your MBQuip data, some of you don't. Some folks find that helpful, some don't. But that's one of the things we thought could be something that as a flex program we could use to implement and to kind of support improvement. And then we would also periodically conduct one-on-one calls with participating facilities to provide support and assess challenges and needs. So if we were a flex program implementing this project, that would be a high level kind of picture of our 3 questions.
So from there, we take the answers to those questions and kind of put them into a plan format. So this will look familiar. This is exactly the same plan example that's provided in the template. So what will we, the flex program, do that will result in an improvement? This is high level. It's not comprehensive entirely, but this is the type of thing that we're looking for from you all. So we're going to recruit 5 hospitals to participate in the initiative. Susie's responsible for that. We need to have them on board by August 31st. And we're going to have our hospitals sign a participation agreement. So that's how we're using our notes section there. We're going to collect baseline data, their COVID-19 immunization rates as of August 31st, 2021. Bob's going to lead that up. We need that data by the end of September. We're using the NHSN definition, and the hospitals are going to self-report to us via email using a template that we're going to provide to them to give us that information so that we have a standard way of collecting it and know that they're all collecting the same thing. So we're going to provide them with the measure definition and that type of thing with the template so that we're sure that we're getting the same information. We're not collecting patient level information, so having them send it to us via email is perfectly fine. We're going to collect and develop tools and resources to support our cause with immunization. Susie's going to be doing that while Bob's working on collecting the data. We're going to convene the hospitals for a kickoff call towards the end of October, where we share our tools and intervention options. We're actually going to walk through the PDSA model with our hospitals and ask that they submit a plan to us so that we're able to kind of track on their progress throughout the year and understand what their plan is. So that we can understand at the hospital level what really worked and what didn't. And we have a standard way and format to be able to talk amongst the participating hospitals. We're going to do one-to-one calls, at least one in November, and then as needed. So those one-to-one calls in November would focus on the PDSA plans. We're going to collect those plans from the hospitals and understand what interventions they intend to implement in order to drive up their immunization rates. We're going to collect performance data from the hospitals on a monthly basis during the performance period. We're going to convene the hospitals monthly and share their PDSA plan updates and provide opportunities for the hospitals to share with each other. And then we're going to gather hospital feedback for every convening that we do so that we have an understanding of what worked well, what didn't, what format, how's the peer sharing going, what else would they like to see, and we can improve as we go. So those are those mini PDSA cycles that Carla talked about that we can be doing as we go along. Maybe on the first call, nobody spoke. And so folks have some suggestions or ideas of how we could improve. Or maybe we decide to move from being remote to meeting in person. And instead of being monthly, we're going to do bi-monthly or whatever the case might be. We might make some tweaks to this plan as we go, as we learn what works for our participating hospitals. When we get to what will we measure to evaluate the test of change, now we're going to look back at the plan and say, okay, what aspects of our plan can we measure? So we want to for sure make sure there are a few things that we want to make sure that we're measuring. And I'm going to ask Megan to jump in here and kind of speak to what FMT is going to be looking for and how those first few lines are kind of essential components of your measurement plan.
Yeah, so like Sarah said, you're going to look at your plan and see what types of things you're going to be doing. And so the bigger pieces at the top here, so the number of hospitals achieving the goal performance, that's a measure that you're going to track. And like it says in the notes there, using data outcomes from the next page. So we'll get to that table about what that specifically means. But you're going to set your goal for how many folks you think are going to hit whatever that measure is. The other things that you're going to want to track, mostly because you're going to be asked for them at the end of the project and in the middle of the project. So the Flex monitoring team is going to be leading some evaluation of the improvement labs themselves. And so we'll be collecting this information from everyone, both at kind of the 6-month point and at the end of the project next September. But looking at things like what are you actually doing and who's participating in them? Because we're going to be looking at that data in conjunction with the performance data from whatever measure you're collecting in tandem to see what are folks doing, what are state flex programs doing, and then how are the hospitals, are they improving on the goals that they wanted to improve on. And so here in this example, we were doing both convenings and one-on-one technical assistance. And so for both of those, it's important to track the number of hospitals and which hospitals are doing those, or they're participating in those, and then how many times. So if you do a convening every month or every quarter, which hospitals attended those programs, those convenings, and same with technical assistance. If you provide it, one hospital never participated, but one hospital had 4 one-on-one technical assistance conversations throughout the year. And so making sure that you note those as you go along so that you're not at the end of the project or 6 months in trying to say, oh, who was at that convening that time? And so these are important to track as you go along. And then for each project, this example, these are just some examples of other measures you might want to collect based on the plan. Like Sarah said, these are going to vary for each project depending on what you're doing with your hospitals, what you're planning. And so the number of hospitals that submitted a PDSA form, this is because in this example, we've decided to do PDSA with each of the hospitals. That may or may not be something that you're choosing to do. Same thing with the last number of hospitals indicating satisfaction with the convening. So that's something that you may choose to track along the way. You may choose to ask at the end. And so these are something that aren't necessarily going to be related in your project, but just based on what you're doing, maybe something that you want to track and measure. Sarah, anything else I'm leaving out on this one?
No, I don't think so. I think that's great. And we will circle back to questions here in a moment. The next section is the final portion of your plan that will be due at the end of July, is what will you measure to evaluate the test of change at the hospital level? And so Megan, I'll let you speak through the example we have here too.
Yeah, so here, like we talked about, filling in first the measure, that's that measure that we identified from the NHSN. And so there's the measure titled, and the definition is listed. Those were taken from the information from the CDC. So that's something that you can hopefully pull from wherever your measure information is, and the link to the specifications right there as well. The data source, that's how you're going to be getting that data. And so in this example, we are getting the data directly from the hospitals. This may be something that you're working with your subcontractor to do. This may be something that you're pulling from some sort of database or other reports. And so that data source piece is really how are you going to actually get the data as the State Flex program, the individual hospital level data. And then looking at the table, this is something that you'll create. So the little italicized kind of brackets, you'll fill in the information on, when is this data collected? So you have your facility, you list all of the facilities participating. You have your baseline performance. Again, that may not always be applicable for whatever you're collecting. So this is for every one measure that you have. So you have a baseline, you have a performance goal. So for Hospital 1, they had 75% of their healthcare personnel vaccinated as of the end of August. The goal is 80% for all of the hospitals. Like Hospital 5, we say it was not available or not submitted. So you may not have everything completely filled out. As you go, the 6-month performance and the project end performance, those are really important. Like I said, we're going to be collecting this information at both 6 months and at the end of the project. And so again, it's important to have those. In your project, you may be collecting this information more often. So in this project, we said we'll be collecting that from the hospitals every month. But at the very least, you'll pull them at 6 months and the end of the year. Again, this may not apply. Some measures will only be a yearly measure. Some things may not change. So there are instances where this doesn't necessarily apply. And like Sarah said, you can adapt these tables and their information as needed. You may have data related notes. So here the hospital was able to provide information and other notes. And so something we decided to put in this other notes is we had multiple interventions that the hospitals were able to choose. And in this case, we put which intervention this specific hospital selected. They selected A or B or both A and B, so that we could kind of track on what intervention they selected and if there was improvement there or how much improvement was there. Something to keep in mind for folks who are looking at multiple measures. So for instance, those doing swing bed and you listed 4 or 5 measures that you're going to be looking at, you would have 4 or 5 tables like this. So each table is for one measure. In this case, we're only looking at the one measure, so there's one table. So you may replicate this table for different measures and do that throughout. Let's see.
Thanks, Megan. All right. So we have reached the Q&A portion of today's presentation. I know that there are questions that have been coming in chat and some answers that are coming through, and Tracy's going to help us sort through what has and hasn't been answered and make sure folks get the answers to those questions. Our intent is to offer a space for you all, if we get through some general questions and answers, to do some breakout groups, one focused on data and measurement and one focused on hospital engagement. If there are enough questions and answers to take us through to the end of the session in general, and folks would prefer to stay together as a large group, we can do that. You can always bring your specific data and measurement or hospital engagement related questions to the office hours next week or send them to us in an email. So if we get through Q&A relatively quickly, we'll have an opportunity for some breakout sessions if folks want to talk like down in the details about some of the aspects of your specific project. If you have high level questions about what's being asked of you or the template itself, things of that nature, now is the time. So folks can unmute themselves to ask, and maybe we'll start, Tracy, with anything that's in chat that we haven't gotten to yet, because I've seen some flurry over there.
Sure. I think the one question that hasn't been addressed yet is if programs are supposed to have their hospitals identified before they have their notice of award.
So I'm going to defer to FORHP. Anything that talks about an NOA is out of my out of my league.
I'm trying to unmute myself. So at this point, we understand that some states may be needing to wait to engage with their hospitals directly. So some of you may have those hospitals already identified. Others are still in the process of working in partnership with their hospitals to identify them. And I understand that that is a process that may take some more time. So for this particular table, for the states that do not have their hospitals identified yet, we do want to see a general sense of, you know, your ideas for how many hospitals, and so having, you know, hospitals 1, 2, 3, so forth, as laid out on that example would be fine. And then you can add in the notes that those hospitals need to be recruited and what your timeline is to recruit them. So just a little bit more information on your plans for engaging the hospitals. So that will become important, even if you do not have those identified. You know, we want to understand what is the plan, how many hospitals exactly are you aiming for, and how are you going to be engaging them in either, you know, do you have already identified benchmarks? Because for some measures, those are already feasible to work with, or are you going to be identifying those with your hospitals? How does that play out for your specific project? So I think it's very project specific again, and that's why you have flexibility with template to really adapt it and add notes as you need. But Megan
Natalia?
or Sarah, feel free to jump in. Yes.
Natalia, can you hear me? It's Catherine.
Yes, I can hear you.
Yeah, so if I'm to read Stephanie's mind, you're welcome, Stephanie. I'm wondering if the question might be that some states are strict on when you can put time into a project that starts September 1. So if you're putting time in and effort in, and I'm just guessing this might be the issue, in July, for something that starts in September 1, like recruiting the hospitals and maybe working with a subcontractor, which you're not allowed to do until you have a contract in place. So I think maybe the larger question is the expectation that we are to be putting work and effort in now before the project technically in writing starts on September 1st?
So what we asked at the NCC time was for a general idea of your concept. We approved those concepts, and the expectation is that, you know, shortly you will be getting your NOAs to begin the work for year 3, September 1st. So what we're asking you all to do at this point only is to think about that plan. So at the flex, so again, going back to this particular project is at multiple levels. So we understand that hospitals may not be able to begin until after September 1st. But at the flex level, each of you, regardless of whether you have all of that work contracted out or not, you may have already plans in place for what those contracts may look like, the activities that you're hoping to accomplish. And so we're trying to understand at the flex level, what is your planning for executing the project? And that will become really important for us to know before we start the project, so that we can really help you throughout the process of implementing the project. I think the planning phase is the only expectation that we have at this point, and it's really just adding some additional detail to the plan that you provided to us, which you may already have, but because it was condensed into one form, we were not able to fully get to see that picture across. Some of you had more details than others. So this is just to provide you an opportunity to start thinking of that planning so that you can be in a better position to really work with your hospital September 1st, beginning September 1st, to execute the project. So Sarah, feel free to jump in anything.
Yeah, so what I would say is, you may not have this, you may know what your goal is, or you may not, because you don't have your baseline data yet. We're interested in this right now. We're interested in knowing what's the measure, what's the definition, where are you getting the specifications from, and how are you going to collect the data? Or how do you anticipate collecting the data from your hospitals? So you might not be able to populate any of this yet. Your plan might be to recruit 5 hospitals by September 30th, because that's what you're trying, that makes sense. This is just to show you that by the end of the project, you'll have all of this populated, and we wanted to give you an example of kind of what you're looking towards. But you obviously won't have baseline data yet necessarily. Maybe you do, I don't know, but I don't anticipate most of you will. Your 6-month data, your project end data, you won't know what their interventions are, any of that, but we're really interested in knowing this top portion for the purposes of the July 30th deliverable.
That really helps, thanks.
I see there's a couple questions in the chat, but I also see first that Alia Hayes in New Hampshire has her question raised. Alia, do you want to unmute yourself?
Hi, thank you, Tracy. So I think it's interesting to hear how it sounds like the majority of states are going in the other direction from how we've been doing it. So we actually asked hospitals who wanted to participate first. So we have the full engagement of 7 hospitals, but we're still at literally our second or third meeting actually is this Thursday. So we're, I'm hoping to get everything kind of wrapped up in terms of this template and getting it submitted. But if we were to have the reverse problem where we haven't, like we know we're going to focus on falls, but which measures, et cetera, are still being worked out, is that acceptable? Because I'm actually coming from the other side where we want to do it first based on what hospitals are feel like they're ready to work on, as opposed to deciding based on the data that's out there, I guess, what we should work on first.
I would say the good starting point will be going back to each state's NCC. So in your form, you identified the measure, because otherwise we as POs we would have gone back to you and asked, this is not filled in, like we need complete information here. So all of you got approved because those components were in there. Now, going back to that slide with those specific questions on top above the table, that is asking you to provide just slightly more detailed information around what you wrote in your NCC. And so for some of you, again, you may have this information readily available. For others, it may require some brainstorming. But understanding how you will use the measure and making changes to that, like that will really be the foundation for what you do with the project. So it is really important that by the time we begin, especially as you work on engagement with both your contractors and the hospitals, that you have a clear understanding of exactly what measure are you going to be using. To, again, you don't have to have the perfect answer, because the purpose of this is, we're doing multiple PDSAs. If it doesn't work, then we try to help you think about it. And that's what we're trying to identify is, where are you in terms of like being actually ready to start September 1st with everyone involved? Or, should we take advantage of this office hours to really help you think through those very important questions that ultimately, if you need to change your project, that's fine, because we've gone through the process already of, really thinking of the nuts and bolts of what would work, what wouldn't work. But we can't go 2 months into the fall and then sort of make a decision to completely reverse and switch your entire project. So I think at the core of this is just that we want to make sure that you're successful in implementing your project. And to do that, is very important that you have clarity around really how are you measuring the improvement. And so that goes back to those very specific questions and details that you may not need everyone in your team involved at this point. You may not need all the hospitals at this point, but to have that general idea will really set you up for success.
Hey, Natalia.
And to note too, Alia, that the initial plan, the draft plan, is due by July 30th, so that we as partners can review it and determine who we should follow up with during August to get everybody ready by the September 16th kickoff. So if you submit it and you don't have any of your measure stuff figured out, now this isn't to say that everybody can just leave big portions blank, because that's not going to do us any good. But if that's a big question for you or for others, then that would be something we would follow up on and be able to provide technical assistance around.
Okay.
So that's what we're looking for, is high level, what do you have planned? Yeah.
Okay, that's really helpful, because I think it's the July 30th thing. I mean, a week from Friday feels really fast, versus like September 1st, and just wanting to be really specific and ironed out so that it is what we plan to do, as opposed to just throwing something in there because it's due July 30th, if that makes sense.
Yeah. I want to quick address a couple questions that came in chat. I know I see a couple hands raised. When will you find out what states will be in your learning labs? We anticipate that we'll be able to announce something about that in the lead up to the CKG in September. So we're waiting for your plans to come in so that we can kind of see what actually resonates, what things are common, what things are not, what approaches are people taking, how do we want to arrange the QILs, and then we'll be reaching out likely in the lead up to the VKG, if not immediately thereafter, to start getting things scheduled. And then Danielle, to your question about timelines, TBD is perfectly fine. Again, to kind of get to Alia, what we'll be doing is kind of looking high level and saying, okay, this state has it completely fleshed out and ready to go. These states have question marks here, here, and here. Those make sense. These questions don't make sense. We want to follow up and make sure we're providing guidance and support so everyone's ready by mid-September to launch when we have that VKG. Misty is asking how you submit the plan. So the submission is to send it via email to task@ruralcenter.org.
I think we can say close of business
Uh,
Hawaii time.
Let's say midnight, midnight Hawaii time. I'm not going to look at them over the weekend. I don't think anyone else is either. So
Yeah.
Yep, whatever time zone you're in, just by the end of the day for you on Friday.
I know that it's nice in Hawaii all the time, but it's only nice in Minnesota for like 2 months. So I don't spend my Saturdays reading people's proposals. That's not how I spend my Saturdays in the summer.
I see that Kenyatta also has her hand
You?
raised for a question.
Yeah.
Hey, I have a question for Natalia. In states where COVID is on the uptick and continues to be rising, one thing that we may need to pivot, because our project is asking the hospitals to do a lot in terms of output. And so I'm thinking that we need to look at changing our QI project to be more of an input, us giving the hospital something in opposition to asking them for something, because the burden on the hospitals right now, especially our small hospitals, is going to be significant because our bigger hospitals are at capacity, which means that our smaller hospitals are definitely hurting. So if we decide to pivot, what would be the appropriate steps to that? But also, I want to make sure that we benefit from being in a learning collaborative, which is why I shifted away from the community health worker project, because we wouldn't have anybody to work with probably. So how do we get an idea of what other people are working on so that we can have some idea of which direction to go, if any of what I'm saying makes sense?
Sure, Q, I can answer that. So if you do need to make a change because of those external circumstances that are out of your control, and we do understand COVID, of course, we need to have flexibility around. So I would point you back to the initial form that was due at the beginning of when we first requested that in your NCC. And just go through the process of filling that out and submitting it to your PO. In this case, that would be me. And then we can discuss, what supports may be needed. So the only thing that I want to highlight is that it is completely appropriate to really do something that is more in line with the work that the hospitals are doing. However, it still needs to be a quality improvement project, and we can certainly help you with direct technical assistance to help you shape that in a way that is still capturing a quality improvement project. So there are certainly ways that you can ease the burden on the hospitals for this type of project. And depending on what you have in mind, it might make sense to join a call with the Stratus Health team to have more specific advice on the type of measure that you may want to consider that has been, that have a lot of experience seeing how that implementation turns out at the hospital level and what has worked, especially during times of COVID. So I would just encourage you to schedule a call, and we can go over some of your ideas and help you brainstorm.
And I would also add that everybody will be in a QIL. So certainly, I think we haven't entirely decided how those are going to get broken up. We have talked a little bit about potentially topic-based, but even for those of you that aren't doing a topic that a bunch of other people are, there are some groupings of types of topics. We also might look at like data submission path, or that's part of the reason we're looking for more information. So regardless of what you choose for your topic, you will have an opportunity to be part of a quality innovation lab and sharing and learning from each other. You may or may not be doing the exact same measure. In many cases, a lot of you will not be doing the same measure as the other flex programs in your QIL, but that's a standing opportunity regardless of what your topic is.
Tracy, I think we got through the chat. Yes. So
I think so. Yep.
Q&A was a success in that we answered all the questions that have come in. We did not get to breakout groups, but that is just perfectly fine. We will have time during the office hours next week. You can always send your questions to task@ruralcenter.org, and they will pass them along to whichever partner is most appropriate to answer them. If you can't tell by the collaborative nature of this presentation, this isn't everybody's in it together. Task, FMT, F4HP, Arquita, we're all working together on this. So as always, there's no wrong door. Just a couple of fun words of wisdom. Start where you are, use what you have, and do what you can. And a good plan today is much better than a perfect plan tomorrow. So don't get hung up on the plan. It's meant to be information for us and for you, and it should help guide your journey. It's not going to be the end all and be all. If you have questions about the template, if it's not working, whatever the case might be, if there's something you want to tweak, don't hesitate to ask. We're not grading them. You're not going to get an A+ or a D or anything like that. We're just looking for information from you all and hoping that this will be helpful in guiding your work going forward with this QI project. So I think we are right at the end of time. Any final questions?
And I just want to say I appreciate everyone's efforts in really being thoughtful with their projects. We're hoping that you see that our concern is really around making sure that we set you up for success, that you have the right tools, and that we know how to help you to get there. So I think, definitely there is no wrong question to ask, and people are at different places. So that is also a big consideration. We are going to be looking at each state's needs individually in the best way possible that we can. And I would just encourage you to work through your PO. We're always here to, support you and make sure that you meet your aims. Some of you have partners that you work with, and we want to make sure that you have the right tools in your toolbox to work with them starting in the fall. And others are flying solo, and that's okay too. And we want to make sure that you feel supported. So this is a community of practice, and starting now before we formally launch, I want you all to have that feeling of this is a culture of safety. You can come with questions, and there's no judgment in starting over. So thank you.
You took us to a minute over, Natalia.
Sorry.
Thanks, everybody.
Thanks all.
Thanks, everyone. We'll be back tomorrow at noon Central Time, and Tom Morris from the federal office will kick us off with our welcome.
Thanks, Caleb. Thanks, everyone. Take care.
Thanks, Tim.
Thank you.
Thank you.
Like the haircut, Caleb.